Hi, I'm here right now in Greenville with Dr. Cedrek McFadden, our 7 News medical expert, as we talk about the questions that you guys are sending in on the 7 News Facebook page, and we're getting plenty of them today. Jennifer and Lisa asking the same question, actually. They're saying, does anybody know when this might be gone, which is sort of a constant theme. Everybody wants the answer.
We all want it to be gone. We don't really know exactly when that's going to be. We see across the states that many of us are reaching those peaks, those peak dates, and hopefully as we reach those peaks, those numbers will continue to dwindle. But this may be something that in some ways is still present even through the summer, even through the fall. We just don't know exactly how long.
And South Carolina expecting the peak?
I think April 30th was the last date that I've seen.
So we're not there yet as far as that goes.
April 30th.
Okay. And then Brittany, sort of on the same theme, asking, so weather's warming up. How quickly will the virus subside? Do we think it's connected in any way?
Well, we look at what's happening in places like Australia and Iran already have warmer temperatures. The virus is still spreading there.
Yeah.
So this may not follow the same pattern as influenza, where during the summer months it goes away.
Laura is asking, if you test positive to have the antibodies, does that mean you're safe to go out in public? And are there places to get tested for this yet?
So we would hope that if you had the antibodies, that means that you're safe. The problem with this is we're not sure how strong that immunity is and how long it will last. I think that the better answer is still maintain that precaution because we're not exactly sure how much protection. The tests are being developed now. The FDA, I think they've released one emergency use authorization, but you're going to start seeing them become more available at your doctor's offices, your hospitals, and that may be a great way to help us get back to a sense of normal life.
Yeah, try to get back to work and other things if you haven't been able to do that yet. Linda is asking, I have underlying conditions, haven't been out of the house in a month. I'm getting headaches. Is this a symptom of the virus? So
headaches not one of the ones that we talk about, but up to 14% of patients with coronavirus will have mentioned they've had headaches. It's still not one of the and again, if you've been in the house for a month, it's probably unlikely if you've not had a lot of contacts that you're infected with coronavirus.
Mary's asking, if you're on a vent with COVID-19 and otherwise healthy but over 70, what's your chance for a positive outcome?
So it depends. Not having any other health problems is a really great thing, but it depends on how long you're on the vent and what the course is while you're on the vent. Are there other problems coming along with it? Are you anemic? Is your heart starting to have issues while you're on the vent? A lot is determined by what's happening and how long you're on that ventilator. But the fact that you don't have any health problems is certainly a good sign.
And really quickly, Donna asking, she's getting grocery deliveries, boxes, wiping things down. Does she need to worry about anything else?
Yeah, a lot of the experts are saying that really doesn't make that big of a difference. But if you are going to have boxes and things delivered, you want to clean the surfaces of those boxes, clean your hands after you've used them, put those things away, because again, if you're putting the can of soup in the fridge or in the counter for 3 or 4 days before you use it, that virus will hopefully be killed off by the time you go to it. So just use some basic cleaning.
Dr. Cedrek McFadden, our 7 News medical expert, thank you. We'll see you again on Thursday with more questions. Add them to the Facebook page.